Good evening and welcome to tonight's episode of Dr. Melissa Medicine Woman. I am so delighted that you have joined me live this evening. Tonight, we are going to talk about marijuana. That's right, marijuana and the effects of marijuana and medical uses for it. So stay tuned. Tonight, we will be talking about that. Now, this show and all the content are for educational purposes only, not intended to diagnose, treat, cure, or prevent any disease or psychological disorder. A specific pharmacist patient or physician patient relationship is necessary before any medical therapies are initiated. Please consult your pharmacist, physician, or other qualified healthcare provider with questions about your medical conditions and before starting or using any dietary supplement, herbal remedies, exercise, or nutrition plans. So let me tell you a little bit about myself. I'm Dr. Melissa Balizan, and I have over 26 years of experience in both the Eastern and Western medicine. I combine both Eastern and Western medicine, optimizing the amount of medications and or supplements that you take, where we do decide whether the amount of medications that you're taking is the right amount for you. We optimize that amount. And I speak to hundreds of patients a week, thousands and thousands of patients I have helped to optimize their health, helping them live more vibrant, vital lives. I am the root cause doctor, the medicine woman, and I help reduce those medications. So my physician friends call me a deprescriber. I am your concierge consultant pharmacist, and I'm delighted to talk to you tonight about marijuana and the effects that it can have and the benefits and the side effects. So when we talk about marijuana, we talk about cannabis sativa. That is the botanical name for it. Now there are over 200 street names for marijuana: Mary Jane, gangster, boom, dope, weed, pot. You've heard these, okay? But let's talk about what is marijuana. So marijuana or cannabis sativa, cannabis, it's a green, brown, or gray mixture of dried, shredded leaves, stems, seeds, and flowers of that cannabis sativa plant. Now, marijuana is used most predominantly for its psychoactive properties, so the mind-altering properties, as a recreational drug. And it is used for some medical ailments. Now, the active ingredient in cannabis sativa is the high THC component, or the delta-9 tetrahydrocannabidiol. Okay, now, according to the National Institute of Drug Abuse, marijuana is one of the most abused drugs in the United States. Now, some states have legalized it. Now, this was before the legalization, and still to this day, even in places that are not legalized. Those states that have legalized it, there are very specific requirements on where and when you can utilize it. You can't cross state lines with it. So let's talk about the marijuana. Now, before we are going to talk a little bit about CBD as well, and I want you to know the difference, okay? So CBD is the non-psychoactive component. Now, CBD can come from hemp or it can come from marijuana. It's often derived from hemp because of the fact that when you derive it from marijuana, you have the THC component, that delta-9 tetrahydrocannabidiol. Now, and when we want to limit that psychoactive effect, the CBD, we try and derive it from the hemp plants, okay? So that's the difference. Now, we are going to talk a little bit about CBD, but mostly about marijuana tonight. So then we also have marijuana extracts. So sinsemilla, you may have heard of that one, hash, contains very, very high amounts of THC. And what happens is that allows you to have that greater high, that greater psychoactive effect when you're using the hash oil or the shatter. Now, people use marijuana, they smoke it, they vaporize it, they eat it, they drink it. Okay. So marijuana can be inhaled through like a cigarette called a joint. It can be done through a bong, like a glass pipe. It can be smoked in blunts. Now, blunts are where you take the cigar and you've emptied out most of the tobacco, you refilled it with marijuana, and usually it has some other yucky stuff in there, crack. Now, so you've got tobacco, you've got marijuana, and you've got crack. So this is very harmful because it's got the nicotine remnants and it's got harmful other chemicals. So blunts, not a very good choice. Now, vaporizers are often used as well. Now, the vaporizers, what they do is they concentrate that THC. So you're not inhaling, okay, the smoke, but you're getting that concentrated THC. However, this can lead to an overdose of THC because you're getting it such concentrated, you're not getting the smoke. Now, people mix it in food and in teas. We've got edibles around, recreational use of marijuana, cookies, brownies, candies, gummies, for those that prefer not to drink it. Now, these look just like regular candy. So be careful, be cautious, because if your children get a hold of this, it can be deadly. Now, edibles typically take about 30 minutes to 1 hour to take effect before you see that high. Okay. But that high can last for hours. And so what happens is people think that they're not getting high, so they take more. And then they end up in an overdose. Okay. And they can end up with unpleasant side effects, even into the emergency room. We're going to talk about those side effects in just a little bit here. Now, marijuana or THC is strongly absorbed by the fatty tissues in most of your organs. And for that reason, it stays in your body for a while. So it can be detected for weeks. You have to go through a drug test. So just keep that in mind. Now, the main active ingredient in marijuana, we talked about the THC, is the delta-9 tetrahydrocannabidiol. That's what gives it that mind-altering, that psychoactive ingredient, okay? Now, the highest concentrations of that THC are found in those dried flowers and those buds. And people who inhale through smoking, it passes into the lungs, directly into the bloodstream, then goes to the brain, and then affects your other organs, okay? Now, if you eat it, it takes a little bit longer. It's going to be digested. So 30 minutes to an hour, like we talked about earlier. Now, the brain. So I talked about that it goes to the brain. So in your brain, and in your body, you have cannabinoid receptors. So cannabinoid receptors, that's right. They were already there for a reason. And your brain, when those receptors, so when the marijuana attaches to that receptor, it fits in that hole and you get that euphoria or you get that high. So what happens is it's that endocannabinoid receptor releases dopamine, which is a neurotransmitter, and dopamine is that feel-good hormone, that reward system. So certain areas of your brain, like the hippocampus, the cerebellum, the basal ganglia, and the cerebral cortex, have higher levels of those cannabinoid receptors, okay? Now, these receptors, these areas, they influence your memory. They influence concentration. They influence pleasure, coordination, sensory, and time perception. So think about that. You're enjoying yourself. You're getting that high. But you may not be able to remember things as well anymore. You may not have as much coordination. Now you may have pleasure, but at what cost? So keep that in mind. Okay. So you've got that feel good, relaxed state, that euphoria. Whew. And sometimes you get that enhanced sensory perception. So some people feel very anxious, especially if they're the first time using it. You can feel very panicky. Now, of course, this is usually very first time or those who are using it for higher amounts when they have stronger strengths of THC. Now, in the United States, certain states have legalized it, and some states have a little bit more of a regulatory process than others. So they have to go through processes very similar to medications being manufactured. And those states that are following these good manufacturing processes, going through and doing their testing, going through and having their third-party testing, checking to see the purity of their ingredients so they know exactly how much marijuana, how much THC is in a component, whether it's medical marijuana or whether it's recreational marijuana. That makes a difference. Okay, so back in the 1990s, on average, 4% THC was the component of what you could find around, okay? And today, upwards of 50% or more. Now that's not safe, okay? You might get a better high. But think about all those memory cells you're losing. All right, so let's talk logistics. So marijuana initially, and still is, I believe in most cases, classifies as a Schedule I substance as a Schedule I, which means that it's proven that it doesn't have any approved medical use and it has a higher abuse potential. Now, as I said, certain states have legalized it, and we have seen some potential. And let's talk about that because there is some benefit, and there is actually some medications that have been around that are derived from THC. So a prescription medication that was derived from the 9-delta tetrahydrocannabidiol, dronabinol, or Marinol. Now, this is a synthetic cannabinoid, okay? So they've synthesized the THC in the lab. Now, this is a pharmaceutical prescription medication that has been around for a while, okay? Now, this medication is considered a class 3. So it is shown that it does have some benefit. It has been approved to treat patients who are receiving anti-cancer medication like chemotherapy, who have nausea and vomiting, and those that aren't responding, especially to other treatments, specifically for nausea and vomiting. And I have seen proven benefits of it being used to treat anorexia. So associated with weight loss in patients, especially with AIDS, okay? So it helps them to gain weight, and there's beneficial effects there. Now, there is a new medication called Epidiolex. Now, Epidiolex is a cannabinoid. It is the CBD, and it is a cannabinoid product. It's approved by the FDA back in 2000, and it was first made for seizures with patients, especially children who have Lennox-Gastaut syndrome. Now, this product is that CBD we talked about. So it is synthesized in the lab, okay, but it is proven to have beneficial effects for seizures. Now, there are some side effects of the Epidiolex: sleepiness, diarrhea, sedation, possible liver damage, but it helps severely with those seizures that your child is having. And so the benefit outweighs the risk. Okay. Now, when we go back to look at marijuana again, we look at the fact that close to 18% of the people age 12 and older have reported using marijuana back in 2020. Now that's quite a bit of people utilizing it, okay? So the effects of marijuana will vary from person to person. You might get that euphoria right away. It might take a while. There are some side effects, okay? So let's talk about that. So you may have distorted perception. So your mood, your sight, sounds, time, and touch, all distorted. You could have a slower reaction time. Your eyes could turn red. You might have dry mouth, loss of coordination and motor skills. You could become dizzy. You could have trouble with your memory or problem solving, increased appetite, increased heart rate, problems with your balance, agitation, anger, confusion, anxiety, panic, hallucinations, delusions, psychosis. So having thoughts, false thoughts or beliefs. So believing that things that are happening that really aren't true. Okay. So all of these things can happen with the use of marijuana. Now, I'm not going to say good or bad, but you've got to weigh the pros and the cons of the benefit versus the risk. Now, let's talk about the risk that happens that you could be harming other people. Okay. So if you get behind the wheel of a vehicle, you have been impaired when using marijuana. So it is very similar to being impaired by alcohol. Slower reaction times, impaired judgment, problems responding to signals and sounds while you're driving. And if you actually mix it with alcohol, it's much worse. So what you do for yourself is one thing, but when you get behind the wheel and you endanger the lives of others, keep that in mind because you're impaired. So I recommend that you do not drive while under the influence of either marijuana or alcohol. Now, we talked about panic attacks, okay? So paranoia, psychosis. Now, the longer that you're utilizing marijuana, so long-term effects, it can have heart problems because it does increase your heart rate. If you're smoking it, you could have lung irritation, you could have a cough, you could have trouble breathing. Long-term mental effects such as anxiety, depression, psychosis. You could become dependent upon it. So then you become dependent, and if you try and stop, you could have withdrawal symptoms. So let's talk about the heart, okay? So shortly after smoking or inhaling marijuana, your heart rate increases drastically for up to 3 hours. So it keeps that heart rate up. Your heart is going boop, 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 boop. Okay. So pay attention. So that puts you at risk for a heart attack by up to 4.8 fold within the first hour after smoking marijuana. Especially if you already have high blood pressure, an arrhythmia, or other cardiac or heart disease. Okay. So keep that in mind. Now, when we look at smoking it, we've inhaled it through the lungs. So we talked about it can impair your breathing. It can cause you a cough. It's also possible that it's lead to lung irritation. There is possibility that it could lead to cancer. Okay, so that is possibility. It could lead to long-term shortness of breath, phlegm buildup. So keep that in mind. So how are you going to choose to utilize it? is an edible more appropriate for you? We talked about how marijuana can affect your mental health, especially the psychosis, okay? So it can cause the anxiety, the depression, and according to the National Institute of Drug Abuse, those who have anxiety and depression actually have a higher incidence of actually utilizing marijuana, which then can make their anxiety and their depression actually worse versus better. Okay. We talked about the psychosis, the hallucinations. So if that happens, that's kind of scary to me. I mean, if you start hallucinating and seeing things, it doesn't sound very good to me, but to each their own. Now, what about the addictive potential? Okay. So yes, it can cause compulsive, uncontrolled drug cravings, drug seeking, okay, which then can lead to negative health effects. The dependence can be a craving that you have to have it, okay? And that long-term usage, if you try to go off, you could have withdrawal symptoms. So going off, if that's a choice, because you've decided that it's not good for you anymore, then let's get you off safely. And we want to taper you appropriately off of the marijuana. You can't just stop it, okay? So we've got to do it in a controlled, safe way to get you off of the marijuana. And withdrawal symptoms, okay? So let's talk about what could happen. It could cause you to be more sleepy. It could be more irritable. You could be anxious. It could decrease your appetite. Okay, now these withdrawal symptoms usually occur within 2 to 3 days of stopping, but could be 1 to 2 weeks. You could have trembling. You could have insomnia. You're not sleeping. Be very irritable. You could raise your blood pressure and your heart rate, even as withdrawal symptoms. So keep that in mind. And we want to go off of it safely. Okay, safely. Now, when we talked about dronabinol, a synthetic THC being used to treat nausea and vomiting. So some people think, oh, well, I can get medical marijuana to treat my nausea and vomiting. Now, that's a possibility. Yes, that is definitely a possibility. But what can also happen is that it could have the opposite effect. Okay, so you could end up with cannabis hyperemesis syndrome, where even though we were treating your nausea and vomiting, it now leads to persistent nausea and vomiting. Okay, so we have to determine, is your nausea and vomiting caused from the marijuana? Then we have to slowly taper you off of it and figure out, okay, what is our next step? So just know that that's a possibility, okay? Now let's look at those medical uses, because a lot of states have approved medical use of marijuana. So here are the conditions that I feel and that have some valid evidence behind it being able to be used. So ALS. Cancer-related pain, chronic pain not responding to other treatments, some depression, some epilepsy, glaucoma, AIDS or HIV-related weight loss, multiple sclerosis, some panic disorders, however, it could cause that, Parkinson's disease, PTSD. So these are some things that we've seen some benefits, okay? Now I've also seen that it could be effective for chronic pain. We talked about the chemotherapy-induced nausea and vomiting. There's some evidence that it's helpful for fibromyalgia, because fibromyalgia is a chronic pain type firing of the nerves and the muscles. So giving you a lot of information, okay? A lot of information about marijuana, the pros, the cons, and now it's up to you to decide. Is marijuana something that I should be utilizing? Okay. Do I need to have that high as well as controlling my pain? Or am I looking for a pure product such as CBD derived from a hemp plant, which has been shown to help with anxiety, help with sleep, help with pain control, and it doesn't cause the euphoria. Now, you've got to be careful about what CBD derivative you get. Is it being regulated in your state, following those good manufacturing processes? Because if it's not, then that's not the good one for you. Now, if you want to know more, or if you want to have a good source of good quality CBD, because you want to treat your pain and you don't want the high, contact me. If you want to know more about where to get your medical marijuana or your recreational marijuana, and you have enjoyed listening to me tonight, then contact me. You can contact me at drmelissabalizan.com/TV, and I have a special offer just for you watching tonight. Okay, so drmelissabalizan.com/TV. Go in there, find out. Let's get you healthy. Let's get you on some marijuana if that's the right thing for you. Let's get you on some CBD if that's the right thing for you. To your health and happiness, remember you only have one health, one body. Take care of it now and have a super amazing day.